Hello everyone. We finished talking about the first four types of qualitative research approaches, which are case study, ethnography, phenomenology, and grounded theory. We talked about the uses for each type of this qualitative research approaches. We talked about the benefits and what are the unique characteristics of each type of a qualitative research approach, and how to formulate research questions based on the selected qualitative research approach. Okay, so in today's lecture we will talk about the fifth type of qualitative research approaches, which is narrative research. We will talk about the main features of narrative research and the uses of narrative research. And in the second part of this lecture, we will talk about the ethics in qualitative research. We will talk about the ethical considerations that should be considered when we perform qualitative research. How are the methods to mitigate these ethical challenges? And we will see that ethical issues in qualitative research is much more complicated than the ethical considerations or ethical aspects in quantitative research. Okay, so simply just to know what is the narrative inquiry before we start talking about it in details, or narrative research, it's a mean by which the researcher systematically gather, analyze, and represent people's stories told by them. So it's like just stories told by people, and the researchers or the researcher is going to analyze these data that are gathered from people about their stories. This is simply what we mean by narrative research. So it's a form, again, of qualitative research in which the stories become the raw data. So the stories of that are collected from individuals themselves, about themselves, they are the raw data in narrative research approach. Okay, and this approach has been used in many disciplines to learn more about, for example, the culture. For example, it's used frequently to study or to investigate the lifestyle of the narrator. So the one or the individual who's talking, or the people who's telling their stories in the narrative research, are called narrator. So it's the narrative approach involves also inquiry directed at narratives of a human experience, or inquiry that produces data in narrative form. Okay, so we can consider, for example, written autobiographies and biographies as a part of narrative research. So it's simply are stories that are told by individuals about themselves. These stories are considered the raw data, or the talk from the narrator. It's called can be considered as our raw data, and we can analyze them and produce the final report regarding this type of research. Okay. So the intended learning outcomes from this lecture. After this lecture, you will be able to explain the meaning of narrative research. What is the definition? What is the meaning of narrative research or narrative inquiry. Identify key characteristics of narrative design, which is similar to what we mentioned about the other approaches of qualitative research that we discussed in the previous lectures. We will be able to describe the strengths and weaknesses of narrative design, similar also to other types of qualitative research that we have discussed. We will be able to describe the steps of performing narrative research, and also, as we mentioned, in the second part of this lecture, we will be able to identify ethical challenges faced by qualitative researchers and the ways to mitigate them. And as we mentioned, the ethical issues need to be given special consideration in a qualitative research approach, which is, as we mentioned, it's more subtle and it's just more complicated than ethical aspects or ethical considerations in a quantitative research approach. So we will start our lecture by a saying from Sykes' Angle in 2006. This saying is, human beings are storying creatures. We make sense of the world and the things that happen to us by constructing narratives to explain and interpret events both to ourselves and to other people. So as stated by Sykes' Angle, we human beings are storying creatures who construct narratives to explain our doings as well as to interpret our and others' past and present world experience. So, based on this, we can understand that narrative research can help us better understand the world of teaching and learning, since teachers and learners, like any other human being, are storytellers who engage in narrative acts to make sense of their and others' knowledge and experiences. And we will see throughout the lecture that the narrative research or narrative approach has started in the educational context, and what is the importance of narrative research in the educational context. So we can call narrative research as if it is a storytelling. So narrative inquiry was first used by Connolly and Clarendon as a methodology to describe the personal stories of teachers. And as we mentioned, it is conducted through a dialogue between the researcher and the participants. So defining characteristics of the narrative approach include the collection of narrative stories or narrative or stories from individuals or small groups. Most often, there is a collaboration with the researcher as storytelling engages the audience. These stories tell of individual experiences that often expose the researcher to the identities of that individual. So, the methods of data collection in narrative research or narrative inquiry includes mainly interviews, although you can use other types of qualitative forms of data collection, for example, such as observations and documents. Okay, so it's not only interviews, so you can use other types such as observations and documents in narrative research. And we will take as other types of qualitative research approaches that we talked about in the previous lectures an example to explain this type of qualitative research. So similar to other types of qualitative research, there are several definitions. Here another definitions for narrative research. It's a narrative or story is an account with a beginning, a sequence of unfolding events and ending, and we will talk about what are the elements that should be included and are important to be present in this story or in this narrative. Narrative research puts characters, events, actions, and context together so as to make sense of them, and it generally follows a recognizable form and pattern, for example, such as clinical cases. Okay, so one of the most important uses of narrative research in the literature, it's mainly used especially in different disciplines. And if you we'll talk about healthcare, it's mainly used in the research about life-limiting diseases. And as I mentioned, we will take an example to understand narrative research better, and the example will be from the healthcare research. So other definitions for narrative research that have been found in the literature. Narrative might be the term assigned to any text or discourse, or it might be text used within the context of a mode of inquiry in qualitative research. As we mentioned, it focuses on the stories told by individuals. So sometimes it's the name of storytelling is used interchangeably with narrative research in the literature. So it's a methodology which consists of gathering stories about a certain theme, where the researcher will find out information about a specific phenomenon. So the narrative approach concerns events perceived by the speaker as important, organized, connected, and evaluated as a meaningful for a particular audience. Okay, so again, narrative research or narrative approach is an interpretive approach in the qualitative research paradigm. It attempts to enter the social world of those who are being researched. So sometimes this type of research or narrative research can be referred to as a compassionate methodology, because, as we mentioned, the narrative research attempts to enter the social world of those who are being researched to gain understanding of phenomenon and to interpret them by the researcher. So as we all know that the interpretive approach it means or indicates to one where the data are actually our representation of others people's representations. So as we mentioned, the compassionate or the narrative research is considered as a compassionate methodology, because the researcher or it involves the inclusion of social, cultural, environmental influences on illness understandings, which makes narrative inquiry very suitable for research in health, as it incorporates all dimensions that impact the individual's health experience. So not only as we mentioned, the narrative research, it's not only driven by caring for others or those who are being researched by the researchers, but also to improve their life, to improve their concerns that we are investigating under this research. Okay. So the goal or objective of narrative inquiry is to reveal or uncover the meanings of the individual's experiences as opposed to objective decontextualized truth, which indicates to the importance of the context in narrative inquiry. So narrative researchers look for ways to understand and then present real-life experiences through the stories of the research participants. So, as we mentioned, narrative research gains its popularity from educational research. So why it's important in educational research and the reasons for its popularity in this field is because the increased emphasis on teacher reflection and the increased emphasis placed on teacher knowledge, professional development, and decision making. So there are various reasons why narrative inquiry is valuable for teachers. So by sharing their stories, I mean the teachers, when they share their stories, teachers have the opportunity to reflect on their own practice, to obtain an understanding of their on knowledge also and actions, and therefore they can act accordingly and to make any necessary changes or modifications to their practice based on the shared stories between each other. So also reflecting on their stories allows them to see the whole picture, what is behind their and others' educational doings. That's why we can see that narrative research is an important in educational research. It can be act also as a professional development tool for teachers based on the narratives of other teachers or narrative of other teachers. You can use these narratives as a professional development tool in your teaching practice. So, commenting on the previous slide about the importance and the significance of narrative research in educational research and in teaching, Clarendon, who is one of the leading authors in narrative research, states that perhaps in listening and attending to teachers' stories, we can create conditions that allow us to give them back their stories and perhaps help them see the social, cultural, and institutional stories they work within and that shape them. As teachers begin to awaken to other stories of community, we might see them begin to re-story their stories to live by. Perhaps we can begin to work together to change those social, cultural, and institutional narratives. That's why we mentioned that narrative research is important for teachers, that help them to change or modify their practices according to their own narratives and other narratives. So, what are the benefits of a narrative approach? By using the narrative format to present findings, researchers can access rich layers of information that provide a more in-depth understanding of the particulars of the participant's point of view, and the knowledge gained can offer the reader a deeper understanding of the subject material and extra insight to apply the stories to their own context. So, as we mentioned, the humans are natural storytellers, and as such it's easy to elicit stories from them. In narrative research, the researcher gathers in-depth data, which is easily accomplished as narratives usually provide thick descriptions. Also, based on this, also it's or based on narrative research, it's possible to gather in-depth meaning. Okay, as participants usually reveal themselves in their stories. Okay, so the data collection in narrative research involves focusing on studying one or two individuals, gathering data through the collection of their stories, reporting individual experiences, and chronologically ordering the meaning of those experiences. And these data are collected using several techniques such as interviews, journals, autobiographies, oral history, and field notes. So literally, or what we can say, that narrative research, it's all about collecting and telling a story or stories in detail. So researchers write these narratives about experiences of individuals, describe the life experience, and discuss the meaning of the experience with the individual. This is all about the steps of data collection and narrative research. Okay, so usually narrative research design is focused on studying an individual person. Okay, so the important point that I need to focus on is this point about chronologically ordering the meaning of those experiences. So usually when someone is willing to tell their story, this story, it follows a chronology, and the researcher wants to write this chronology in narrative research. So this is really important to write the chronological order of events or the meaning of the experience in narrative research. And the researcher in narrative research seeks out information in narrative research through, as we mentioned, interviews, journals, field notes, autobiographies, and oral history. So one of the main techniques that is used in narrative research is the use of what we call oral history, which is a method for collecting data from participants by asking them to share their experiences. We have two ways to develop oral histories. Firstly, by interviews using structured or unstructured protocols, and secondly, using annals and chronicles. So basically, an annal is an account of events that happened on a yearly basis by several authors, and a chronicle is mainly it's an account of precise events or chain of events, which are generally written by a sole person, and this chronicle can be completed with a more narrative drive. Okay, so you need to know that oral history is one of the main techniques that are used in narrative research.
So in this slide, we will talk about two important concepts related to narrative research, which is analysis of narratives or narrative analysis. What is the difference between analysis of narratives and narrative analysis? Analysis of narratives, it is the process whereby the researcher collects stories as data and analyzes them into a set of themes that hold across all of the stories. So analysis of narratives, it's somehow similar to a thematic analysis process that is adopted in qualitative research data. So the outcome or the results from the process of analysis of narratives are the themes. So analysis of narratives, it's using paradigm thinking to create descriptions of themes that hold across stories. The second term is the narrative analysis. Narrative analysis, it's the kind of narrative that is constructed by the researcher who has collected descriptions of events through interviews and observations and synthesized them into stories or narratives. So here is the story or the narrative is the outcome. So, and this is what we concern about in the narrative research. The process in narrative analysis is called emplotment, which includes amalgamation of multiple interviews, conversations, and observations into one narrative that encompasses the events discussed, presented in a sequence that creates a narrative plot, as you can see in the figure. So the narrative analysis in narrative analysis process, the researcher collect descriptions of events or happenings and then configure them into a story using a plot line, as you can see, or what we call a narrative plot. So as we mentioned, what we concern about in narrative research is the second concept, which is narrative analysis, and sometimes in the literature they call narrative research as similar or interchangeably with narrative analysis is used interchangeably with narrative research. And the analysis of narratives, which is the first process, sometimes it's called thematic analysis of narratives. Okay. So now we will start talking about the key features of narrative research, as we used to do in every type of qualitative research approaches that we covered in the previous lectures. So what makes the narrative research a unique qualitative research approach? Firstly, it concentrates on individual experiences. So as previously noted, narrative research, which is also referred to as narrative analysis, as we mentioned, is a family of approaches which focus on the stories. So it focuses on the stories that people use to understand and describe aspects of their lives from the stories they tell. Okay, so what is the main premise that narrative research based on? So narrative research is based on, as we mentioned, the premise that people understand and give meaning to their lives through the stories they tell. Okay, so in doing so, people utilize narratives to compose and order their life experiences. Secondly, narrative research reports a chronology of the experiences. So it's use a time sequence of events. So it depends on the chronology as we mentioned previously. Thirdly, it gathers the individual stories told to the researcher or collected through field text. And these are the data collection methods that we can use in narrative research. For example, autobiographies, interviews, journals, and we also mentioned previously the oral history. Okay. So we will continue talking about the key features of narrative research. It describes the context or setting for the individual stories, including the people involved in the story, the physical setting. Setting may be described before events or actions or can woven throughout the study. So this is one of the main aspects of qualitative research in general, which is focusing on the context or the setting. And the setting could include the physical setting, could include the people that are involved in the story. Also in narrative research, there is a collaboration throughout the process of research with the individuals whose stories are being reported, which let's say the collaboration with the participants in the narrative research. So participants are actively involved in the inquiry as it unfolds, and relationship between research and participant are negotiated to minimize the potential gap between narrative and told and the narrative reported. And we will see that throughout the lecture in the coming slides that to make sure to make sure or to ensure the quality of the narrative or the data that are collected in narrative research, we can use the process of to ensure the trustworthiness. If you remember from the first lecture, we were talking about participant validation or member checking, where these data or these stories that are collected from those participants, we can return, or as a researcher, we can return these stories or these narratives to those participants to check for them, to validate them, and to check if they are accurately written. And this process is very important that may help or can help to enhance the quality and trustworthiness of narratives research. Okay.
So, as you can see in the slide, as a methodological framework, narrative research is defined by the following three aspects that you can see in the slide: temporality, sociality, and spatiality. So, spatiality can be referred to as a place, or as you can see, space, or an environment, or where question, or to be asked by where question, where the narratives happen. Okay, so these elements or these dimensions are needed to be concurrently explored in conducting narrative inquiry. So the main point that these three features or these three elements or these three aspects need to be integrated concurrently, which means simultaneously or in the same time within the narrative inquiry while you're doing your narrative research. Temporality, which is related to time, which is related to when question. Sociality, which is related to the personal, social, and cultural conditions, which related, as you can see, to who and why questions, and spatiality, which is related to space or environment or where the narratives happen. Okay. So temporality refers to the events under study which are in temporal transition. So it's related to the past, present, and future. For example, if you can see the example in the slide, past experiences will have an influence on how a patient experiences their present situation. This is an example of a narrative about patients. So past experiences on the patients will have an influence on how the patient experiences their present situation, and previous encounters in healthcare influence also how they perceive their future. Okay. We come to sociality, which is related to personal, social, and cultural conditions. Personal conditions maybe involves feelings, hopes, desires. Okay. Social conditions refers to condition under which people, experiences, and events are taking place. Okay. And these social conditions are typically understood in a way through cultural, social, and language narratives. Okay. So then we come to speciality, which is related to space or environment, or where these narratives happen. So the environment will also influence how an event is experienced by the person involved. So again, to sum up, narrative inquiry explores experiences of people through the dimensions of temporality, sociality, and spatiality. The aspect between these dimensions provides an exploratory structure for narratives surrounding health and illness, let's say. So when we take an example about a patient in a hospital, for example, we can say that temporality related to time. When did the illness begin, and how will it influence the future? Okay. Sociality may be related to, in this example, to cultural and personal influences on views of illness. Spatiality, which is related, as you can see, to space or environment. So spatiality in this condition related, for example, to surroundings such as hospitals and their influence on the health illness perspective. Okay, so one of the most important aspects of narrative research that need to be integrated concurrently within the narrative inquiry is the temporality, sociality, what are the personal, social, and cultural conditions that affect the experience, and the spatiality, which is the space or environment, or the environment, how it influences the event experienced by the person. Okay, how it's influenced the event or phenomenon or experience need to be investigated using narrative research. Okay. So again, we are continuing talking about the three aspects that we mentioned in the previous slide, which can be considered as a methodological framework for narrative inquiry, which are temporality, sociality, and spatiality. This is an example how we can integrate temporality, sociality, and spatiality in this narrative. Okay. So we'll start with, for example, living with a chronic illness or surviving an acute illness can be a life-changing experience. And as we mentioned in the beginning of this lecture, narrative research is very common to be used in investigating life-changing experiences. And these narratives of illness are descriptions of an individual's experience of their situation, reflected by surroundings such as hospitals, previous illness, and life experience. Hence, a person's narrative provides a deep, detailed view of their illness experience and inform how we can best provide future care. This is an example of how we can integrate temporality, sociality, and speciality to gain an deep understanding or detailed view, let's say, in narrative analysis of people's experiences. So integrating all of these elements or all of these aspects, or let's say all of these dimensions together in narrative research will help the researchers in gaining or in obtaining a detailed view of the people experiences. So, similar to any type of qualitative research, as we talked previously about the trustworthiness of qualitative research and how to assure the quality of qualitative research by several aspects or several dimensions. So, what are the questions of trustworthiness, or has a subject told the truth in narrative research? We can follow several methods or several techniques. Firstly, we are talking about prolonged engagement and persistent observation, which enhances the quality of the narrative. So, what is the meaning of a prolonged engagement? Prolonged engagement refers to spending extended time with respondents or with participants in their native culture and everyday world in order to gain a better understanding of their behavior, of their values, and of their social relationships in a social context. Okay? So, by doing this, by doing prolonged engagement and persistent observation, we can learn more about the culture and establishing also trust, which often increases the trustworthiness of the data. So, when you you do prolonged engagement with the researcher, follow prolonged engagement technique and persistent observation, this can increase or establish trust with the participants and increase the trustworthiness of the data. Thirdly, we are talking about triangulation, and as we mentioned, always triangulation is a very important aspect in qualitative research, where we can connect data from multiple sources to increase the validity of our data. And we are talking about also member checking, and member checking is a very important also technique or methods to enhance the trustworthiness, in particular in narrative research, where we can ask the participants if interpretation is accurate and making adjustments in the data and interpretation if necessary. So it's very important to check for to send your interpretation of the data or to send your results to the participants to check for them if they are accurate and precise. This is why it's called member checking, or sometimes it's called as a participant validation. Another technique, which is also important and one of the most unique features in qualitative research, is a provision of thick descriptions. Thick description through descriptions of study contextual factors, participants, and experiences. So, as we mentioned in the characteristics of qualitative research, so a thick description is a term which is utilized to characterize the process of paying attention to contextual detail and observing and interpreting social meaning when conducting qualitative research. So what does that mean? What is the meaning of thick description? So it means describing a phenomenon in a sufficient detail, so one can begin to evaluate the extent to which the conclusion drawn are transferable to other times, settings, situations, and people. So when you describe or one of the methods or techniques to achieve transferability in qualitative research in general is to provide what we call a thick description, which is describing of the phenomenon under investigation in sufficient detail. Okay, and as you can see also, thick descriptions is very important as it helps in contextualizing the data. So now we will start talking about strengths of narrative research. Firstly, stories are sense-making devices. So stories or narratives enable or permit people to look back and make their lives meaningful by retrospectively structuring events and actions that happened maybe in the past in a way that conveys a perceived causality, let's say. So we can explore, for example, from using this narrative research. For example, we can say that X happened because of Y, using narrative research. Secondly, stories are inherently nonlinear, so they depict events or illustrate events as emerging from the interplay of actions, relationships, and context. This is what we mean by that they are inherently nonlinear. So it illustrates or presents how events are emerging or experiences how it's emerged from interaction of or interplay of actions, for example, relationships and context all together to produce this event. Since because of this, we can consider narrative research as a powerful tool for making sense of complex and emergent phenomena. Thirdly, stories or narratives are often evocative and memorable. So, as we mentioned, that we can, one of the most important features that should be integrated in narrative research is sociality, which is related to personal and social conditions, so that we can say that narrative research can be filled with emotions, with personal conditions, and even also they are most people recall them better than they can recall, for example, lists, graphs, or numbers. Okay. Fourthly, stories are necessarily perspectival, which means they're conveying a particular perspective. That means that they are told from a particular person's or cultural group, let's say, point of view, and they provide unique insights into that person's or that cultural group life world and how they interpret it. So they are perspectival, let's say. So similar to any type of research, there are some limitations for narrative research. Firstly, the institutional contexts in which research is undertaken may constrain and distort the stories told. Let's take an example. Let's say, for example, in a study of patients' experiences of interpreting services. Interpreter services, those who are person or interpreter, those are persons that who are in some countries they use them to translate what is the patient say, for example, to the healthcare providers such as nurse or doctor. Okay, so there's a study, for example, to explore the patient experience of those interpreter or interpreting services. So when the facilitator of this study or the facilitator of this focus groups were professional interpreters, participants tend to tell positive stories about their experience with the service. Okay. However, let's say that the facilitator of the focus group was a voluntary sector health advocacy organization. Those participants start or told that they have a deep unease with the official interpreting service. So this means that the context or the institutional context in which research is undertaken may constrain or and distort the stories told. So when the facilitator of the focus group in our example was professional interpreter, the participants told positive stories about their experience. However, when the facilitator was provided from a voluntary sector, so another organization, let's say, so they start to tell about their negative experience with the interpreting services. Okay. Secondly, some narratives simply cannot be told, perhaps because the individual has lost the ability to narrate. So we mentioned that one of the main strengths or advantages of narratives that the stories are usually memorable by people. Okay. So one of the limitations of narrative research that the individual or the person sometimes has lost the ability to narrate his experience or her experience. So, for example, through injury, some people who have severe dementia has been so profoundly traumatized that their story is suppressed. Those people, let's say, for example, may find the task of narration too distressing for them. Okay. Which may place an ethical duty on the researcher to terminate the interview and perhaps revisit the study design. So this is one of the challenges, one of the most important challenges in narrative research, which is that the individual may have lost the ability to narrate, which may affect on the study in general. As we mentioned, it may place an ethical duty on the researcher, and the researcher may be forced to terminate the interview and maybe change the study design because of this issue. So the challenges also of narrative research include that the researcher needs to collect extensive information about the participant and needs to have a clear understanding of the context of the individual life. So it needs you need to collect maybe information about several things in or extensive information in narrative research. Secondly, active collaboration with the participant is necessary, and researchers need to discuss the participants' stories as well as be reflective about their own personal and political background. And all of these represent an extra maybe effort from the researcher to do this and represent some of the challenges of narrative research. So now we will talk about the steps of performing narrative research. Firstly, you need to identify a phenomenon or event to explore. So by identifying an issue or concern which provides the purpose of a study and enables the researcher to understand personal or social experience of an individual. Secondly, you need to purposefully select an individual to learn about the phenomenon. So, as we mentioned, many narrative studies examine only one individual, but several individuals may be also studied as well. So we select an individual who can provide an understanding of the issue. This is the main essence of, as we mentioned, purposeful sampling, which is used in qualitative research. And we need to carefully select this person or this individual based on their experiences. Then we start to collect the story from the individual. So as we mentioned, we have different types of data collection methods or techniques, and that we can use, or the researcher can use in narrative research, such as interviews, field notes, for example, oral history, photographs sometimes. Okay. Then restory or retell the individual story. This step is very important in narrative research, which can be called as restorying or retelling. And it's important and one of the unique features of narrative research. Restorying or retelling involves examining the raw data that we have collected, identifying key elements from them, and organizing and sequencing of these elements, and then retelling a story that describes the individual experiences. So this process or restorying or retelling in narrative research help the reader to understand the story by sequencing it in a logical order. Okay, this is, as we mentioned, a very important point or a very important feature in narrative research. Collaborate with the participant storyteller. So throughout the narrative story collection process, the researcher need to work closely with the storyteller to ensure the participants' experiences are accurately presented. Then the researcher writes a story about the participant experiences and finally validate the accuracy of the report by using, as we mentioned in the previous slides, what we call member checking or participant validation, where we can return the story that has been written to the participant to check for its accuracy. Okay. So finally, the final product in narrative research or narrative analysis consists of the following three dimensions that we have mentioned, which are temporality, sociality, and spatiality. So as you can see, the amalgamated narrative contains the temporal dimension, which refers to the experiences from the past and visions for the future. Sociality, which refers to how the narrative is presented in the cultural and social environment. And spatiality, the narrative includes a description also of surroundings, sometimes both where the narrative was experienced and where the narrative is told. Okay. Now we will start talking about the second topic in our lecture, which is about ethics in research and in particular ethics in qualitative research. And we will see how ethical aspects or ethical considerations are more complicated in qualitative research than in quantitative research. So ethics or ethical aspects are, it's all about protecting the rights of the participants. And we will see some elements that or the elements that should be taken into account while considering the ethical aspects of your research. So, and when you read any research paper, you can see under the methods section, it's placed in the methods section, which is called ethical aspects or ethical considerations, where your study, for example, you put that your study has been approved by your institution, what is the number that has been given to this study, and that all your documents or supporting documents such as informed consent and participant information sheets have covered all essential aspects that's related to protecting the participants and has been approved by this institution. So the introduction of the World Medical Association Declaration of Helsinki in 1964 stressed the importance of establishing research ethics committees or institutional review boards, which is called commonly as IRB. So when you write your proposal and you finish writing your proposal, you need to submit your proposal to what we call a research ethics committee in your institution, and they can assess this, and they will assess this proposal and give you some comments. Maybe sometimes you need to address regarding ethical aspects, and after that they can give you an approval for your study, and they give you a number, or what we call a reference number. You can use it on all your documentation later on in your research process. Okay. So according to the Declaration of Helsinki, these are the principles that have been addressed in Declaration of Helsinki. Let's say firstly, studies or research studies should be designed in the safest manner. Every medical research study involving human subjects should be preceded by careful assessment of predictable risks and burdens. So what are the risks of your research? What are the burdens on the participants? So all of these need to be considered in your ethics. So to protect the rights, as we mentioned, of the individuals, and to ensure that there are no dangers on the participants from performing your research. Participants also in research should be recruited on a voluntary basis. So the recruitment of participants is a very important step also in your research, and these should be considered or should be performed on a voluntary basis. So should be also informed of the research study in order to freely give informed consent, preferably by filling in a written consent form. So consent form could be provided they could be you have a written informed consent, and the participant can read it, and they can agree to participate in your study by signing on this informed consent, and the researcher can keep a copy of this consent form, and even the participant should also have or save a copy of this consent form regarding the particular study, and the informants or the participants must provide entirely voluntary agreement to participate, that is, without physical or psychological coercion. So they should not be feel that they are forced to be involved in this particular study by the researchers. So all of this information are provided by a participant information sheets that should be given to participants prior to commencing your study, and the consent form also should be signed by the participants before commencing your study, and all of these documents, as we mentioned, should be approved by the IRP and research ethics committee in your institution. Okay. So here you can see some ethical principles that should be followed in or while performing the research. Researchers are responsible for ensuring that participants or informants are well informed about the purpose of the research they are being asked to participate in. So as we mentioned, there's something called or a particular document that should be submitted with the research proposal to the research ethics committee, or to the institutional review board, that's called PIS, or participant information sheets. This participant information sheet involves, for example, the name of the researchers, their contact details, also some background about your research, some information about your research, the objectives or your research questions, and the methods that you will use in your research. What is the benefit of your research? All of this information will help the participants to decide whether he or she will be involved in this research or not. Secondly, the participant also should understand the risks they may face as a result of being part of the research. Understand the benefits that might occur to them as a result of participating. So one of the documents that need to be provided for participants in research is informed consent. So here are the elements that should be acknowledged and should be stressed on the informed consent in any type of research. So informed consent stresses the researcher's responsibility to completely inform participants of different aspects of the research in comprehensible language. These include the nature of the study, the participant's potential role, the identity of the researcher, the financing body, the objective of the research, how the results will be published and used, and any potential risks and benefits of the research. Okay. Here you can see some ethical problems that may face the researcher while doing or performing a research. Here I'm talking about the researcher. So, issues that may arise when a researcher gains access to a community and the effect the researcher may have on the participants. So, sometimes the researcher may be maybe not given access or not able to have an access to a particular setting or a particular place to do his or her research. By the gatekeepers of those place or of this place or this setting. This is because sometimes of cultural issues that they think that the researcher may affect on their work. The researcher may to check or to, for example, if you want to talk about hospitals, sometimes the gatekeepers or the those who in charge and the hospital may think that the topic of the research may impact on their institution, for example, in their hospital, for example, if the researcher intends to investigate, for example, a sensitive issue in a particular hospital, for example, such as missed care by doctors sometimes. So the hospital may be hesitant to give the researcher the approval to do this particular research because they may think that this research may impact negatively on the publicity of their hospital, for example, let's say. Okay. Secondly, ethical problems could occur to both researcher and participants, as we mentioned. So for the researcher, ethical unsoundness or physical and emotional risks to the researcher can arise if the researcher faces aggression from the participants. This is one of the risks that the researcher may be in while doing the research. Secondly, undertakes field work at premises unfamiliar to the researcher, which may impose sometimes emotional risk to the researcher. The issue that need to be also taken into consideration that the researcher need to acknowledge that participants can withdraw from a study at any particular time. So regarding qualitative research, as we already mentioned, qualitative research, as any type of research, has some ethical considerations, which is somehow similar to quantitative research, but it's maybe more complex or more complicated and needs maybe additional attention more than quantitative research due maybe to long-term and close contact with the participants, for example, in doing interviews and observation. That's why it's maybe more complicated, or the ethical concerns are more complicated in qualitative research more than quantitative research. So to ensure that the qualitative research is of good quality, there are some aspects or domains that need to be covered in ethical considerations in qualitative research. As you can see in the slide, we have four domains for ethics in qualitative research. As we mentioned, to ensure its high quality. So firstly, we are talking about procedural ethics, which is related to approval processes and human subjects. Then situational ethics, which is related to particular culture that we are conducting our research in, which is called maybe or related to research context. We have ethical relationships, which means the dynamics between the researcher and the participants, and ethical issues in exiting the study, which is related to completion and dissemination of findings and sharing of qualitative research results. So, as we mentioned, the ethical considerations in qualitative research need to cover all these four aspects or domains to ensure its high quality and trustworthiness. So now we'll start with the first domain of ethical considerations in qualitative research, which is called as procedural ethics, which is, as we mentioned, related to the human subjects and approval processes that's obtained prior to commencing the research by institutional review boards. So procedural, also called as a categorical ethics, refer to ethical actions dictated as universally necessary by larger organizations, institutions, or governing bodies, which encompassed by the institutional review board, including mandates such as do no harm to participants, avoid deception, negotiate informed consent, and ensure privacy and confidentiality. So all of these ethical principles that need to be addressed and confirmed in your in research in general and in qualitative research in particular, this is all lie below procedural ethics domain. Procedural ethics also suggests that research participants have a right to know the nature and potential consequences of the research. So all of this informed consent, participant information sheets, protecting the right of the participants, all of these aspects are related to the third domain in ethical consideration, which is procedural ethics. And also it includes understanding that the participants understand that their participation in research is voluntary, and that they are not forced to be involved in this research and exclude coercion. Okay, so as a method or a technique to ensure procedural ethics, researchers safeguard participants from undue exposure by securing all personal data in a locked office or drawer or a password-protected website or computer. So all of these procedures can ensure or can be considered as techniques for procedural ethics and protecting the rights of the participants and securing all their personal data that are used in this research. Okay. Regarding the second domain of ethical aspects in qualitative research, which is situational ethics. So situational ethics, as we mentioned, it's related to a particular context, and your ethical or the researcher need to maybe critique or reflect a particular ethical issues that may arise during a research, and it's beyond what have been specified in the institutional review boards, approvals, and so on, which we mentioned in procedural ethics. So situational ethics refer to ethical practices that emerge from a reasoned consideration of a context-specific circumstances. So it's mainly related to what emerged during research. So it's contextual ethics, let's say. It deals with the unpredictable, as we mentioned, that cannot be specified or pre-specified in the institutional review board. Maybe practices or ethical practices, often subtle yet ethically important moments that come up in the field. This is what we mean by that. It's come up in field work during while doing your research. For example, while observing the participants in qualitative research. These responsibilities go beyond review boards, as we mentioned, and beyond edicts like the greater good and do no harm. A situational ethic assumes that each circumstance is different and that researchers must repeatedly reflect on, critique, and question their ethical decisions. Situational ethics often revolve around the question, are the harms of the research practices outweighed by its moral goals? So it needs to be assessed repeatedly during the field work based on the circumstances that appear during field work. This approach suggests that ethical decisions should be based on the particularities of a scene. So, all in all, what we can say about situational ethics, or situation ethics, it's the position that moral decision making is contextual or dependent on a set of circumstances in the field. Okay. So, regarding the third domain of ethical considerations in qualitative research, which is ethical relationships, it's all about building a good relationship or building a mutual trust relationship between the researcher and the participants in the field. So, relational ethics are related to an ethic of care that recognizes and values mutual respect, dignity, and connectedness between researcher and researched, and between the researchers and the communities in which they live and work. And there are some techniques that can help the researcher to ensure building ethical relationships or to ensure relational ethics. So the researcher as a human instrument in qualitative research, as we mentioned, should always respect others, which includes for example, allowing participants to assist in defining the rules of the research, helping the researcher to practically understand the ramifications for violating traditional ways of doing things. So all of these techniques can help the researcher to build ethical relationships during qualitative research study. The last domain in qualitative research ethics is exiting ethics. So you need to know that ethical considerations extend beyond the data collection phase to how the researchers share their results or present their results in the final report. Certainly, researchers never have full control over how their work will be read, be understood, and used by the audience. However, they can consider how best to present the research so as to avoid unjust or unintended consequences. So, this is exiting ethics is related to how the researcher present the findings to not to be misinterpreted by the readers of his or her research. So there are several ethical challenges in qualitative research. Firstly, the researcher-participant relationship. Let's say that the relationship and intimacy that is established between the researchers and participants in qualitative studies can raise a range of different ethical concerns. And also qualitative researchers face problems such as, let's say, respect for privacy, establishment of honest and open interactions, and avoiding misrepresentations of participants. So what makes qualitative research as unique is the desire to participate in a research study depends upon a participant's willingness to share his or her experience. So, researchers who develop close relationships with participants and share personal information must treat carefully and acknowledge the ethical risks associated with this behavior, such as harming participants at the end of the research relationship and the potential for participants to feel misunderstood. So, the procedures that should be followed by the researcher is to maintain anonymity, confidentiality, and gaining informed consent of from the participants. So, ensuring the confidentiality of the participants is important in this regard, and also ensuring the institutional confidentiality. So if you're doing your research in a particular hospital, for example, so you need also not to protect the confidentiality of the participants or those who are involved in your research, but also the institution that you are doing your research in. So these problems that results can be mitigated by ensuring anonymity, confidentiality, and obtaining informed consent from the participants in qualitative research. So, there are also ethical challenges that may arise during data collection in qualitative research. Let's say, for example, take ethnography. Ethnography, a long presence of researcher among people of a particular culture requires informed consent. When a researcher aims, let's say, to study the culture of certain people, living among them is inevitable. So the researcher in ethnography needs to be physically present in the culture under investigation. This method of collecting data is a subject of debate from an ethical point of view. So long presence of the researcher amongst people of a particular culture requires informed consent. Participants should always be aware of the information that has been obtained and is being recorded and consent to it. Sometimes this cannot be achieved easily and conflicts may happen, as for example in studies of cultural and ethnic characteristics. Another concern or ethical concern, which is the emergent data collection, as we mentioned, that the research design in qualitative research is emergent, and there are some maybe changes during that may arise that need to that requires the researcher to modify the research plan, and the Research Ethics Committee in Qualitative Research must expect amendment to research protocol in qualitative research because, as we mentioned, of emergent data collection or emergent research design in qualitative research. There are also ethical challenges during data analysis in qualitative research, which is mainly due to subjective nature of qualitative research. So as we all know, researchers' subjective interpretation of the data in qualitative research, so that it's possibly that participant views may be misinterpreted or taken out of context by the researcher. So in this way we can mitigate this problem by doing what we call member checking or participant validation, where the researcher can return the findings or the results of the research or the research reports to participants to check for their accuracy. And an important point you need to know that member checking or participant validation by the researchers must be addressed in the informed consent. So the informed consent must address or must mention that the results or the findings need to be returned to participant to check their for the accuracy, for the accuracy to ensure accuracy and validity of the data. So here are the references that have been used in this lecture. So finally, I hope this lecture was interesting.